and welcome to another anatomy painting video. For this video we're going to be looking at the Sternocleidomastoid. The Sternocleidomastoid may appear to have a very long and complicated name, but it is in fact just telling you about its attachment points. Sterno, because part of the muscle originates on the sternum, Cleido, because another part of the muscle originates on the clavicle, and mastoid, because of its insertion point on the mastoid process just behind the ear. So all you do is kind of mash those words together and we get our muscle name as Sternocleidomastoid. This muscle runs right in front of the carotid artery, so we need to be really careful when massaging over it. Typically, it's better to try and pull away than compress this muscle. It gets tight in people with hypokyphosis and forward head posture, and its movements it's primarily responsible for are flexion of the neck and rotation. However, with rotation, it should be noted that your neck would rotate towards the opposite side. So when your right sternocleidomastoid contracts, your head would rotate towards the left. Now, often because of our sedentary lifestyles, we sit at desks and in poor positions. Often people will adapt a hyperkyphotic position, meaning they will slump forward. Because of this, they have to pick their head up, otherwise they'd just be looking at the floor. This actually tightens up the sternocleidomastoid. Because it runs from the back of the skull to the front of the sternum and the clavicle, as it contracts, it can create, or as it shortens, should I say, it can create lower cervical spine flexion with upper cervical spine hyperextension. So what it's basically doing is taking that cervical spine, that neck, and turning it into more of an S shape as the muscle kind of pulls in a kind of diagonal fashion. In fact, this muscle, as it runs so close to the carotid artery, this is the point in the neck where you can actually feel the pulse. If you find your sternocleidomastoid and then move just medially, so just towards the inside, you should be able to feel the pulse of the common carotid artery. In terms of movements, we will get a little bit of lateral flexion, rotation towards the opposite side, and cervical spine flexion. I hope you found this video useful, and thanks for watching.